The mid-20th century was a time of great change in the United States and across the world. The Nazis terrorized Europe while the Japanese ravaged the Pacific. It was a time of revolution in Spain and the spread of communism in Eastern Europe. The space race, the Cold War. At the heart of all these events was a singular moment in 1945, a day that would forever alter the course of history. The day was July 16, 1945. Far out in the New Mexican desert, a team of scientists and engineers gathered in secret to finally test the product of years of effort. Led by Robert Oppenheimer, the men and women of the Manhattan Project had created the most powerful weapon ever seen by man. As the plutonium atoms were ripped apart, a brilliant flash spread across the desert and left a trail of unimaginable destruction in its wake. As that mushroom cloud rose above the desert sand and over Japan a month later, all who witnessed it knew the world would never be the same again. The atomic age was a defining era in history, characterized by both the good and the bad. When we think back on this time, we often picture images of children hiding under their desks in bombing drills, and movies such as Dr. Strangelove and The Day After. But this time also brings us back to an age when anything and everything was possible. We were going to the moon, we were developing new technologies at an ever-increasing rate. People saw the atom as a way to improve lives, not just take them. We lived in the future land, tomorrow world. Clean atomic energy, atomic-powered cars, nuclear medicine. The future shone brighter than the blast that rocked the New Mexican desert just years before. I have always had a strange obsession with this time in America. I find it infinitely fascinating that the same mechanism that powers the stars can be harnessed to both destroy and to save lives. Radiation is a mystery that drives me to dig deeper into the most fundamental workings of nature and find out how it all works. From early in my high school career, I remember spending hours researching the physics behind nuclear fusion and making plans to build my own fusion reactor. I think that's why I chose this radiation exposure meter to research. The meter was created by the Texas Nuclear Company in the late 1960s and was used and owned by Mr. Thomas Pence, a senior nuclear medical technologist at Riverview Hospital in Indiana. As a student of physics, I've always felt a connection with those who dedicate their lives to pursuing knowledge, and I've long admired those who care for the health of others. In this way, I felt a connection with Mr. Pence, as well as the men and women who pioneered the field of nuclear medicine. Nuclear medicine is a complex field that was pioneered by the scientists of the Manhattan Project. It was at the Lawrence Berkeley Laboratory in California in the 1940s when John Lawrence first used an isotope of phosphate to treat leukemia. From there, scientists in the Lawrence Lab, as well as the Oak Ridge National Laboratory, began producing short-lived isotopes that have been used to treat a great number of diseases, such as thyroid cancer. Of course, treating patients with the same mechanism that destroyed Hiroshima comes with its risks to the patients and medical professionals. Because of this, governments in Europe and the United States began regulating nuclear medicine, placing limits on the maximum dosages and exposure times for the technicians who created and administered the treatments. Radiation detectors such as this survey meter were used to measure the dosage received by those in a room and was programmed to sound an alarm if the radiation reaches unsafe levels. Detectors played a vital role in the success of nuclear medicine by ensuring the safety of patients and staff. It took many hours of research to learn the intricacies of this field. I reviewed the documents from pioneering labs and official government publications to learn the ways regulations were implemented to protect those involved in the process. To me, it is incredibly beautiful that the same particles that tore through the bodies of the victims of the atomic blasts in Japan are the same particles that today are used to cure people of life-threatening disease.